Hi class, in this recording we're going to talk about what happens to us during aging. This isn't actually in chapter 1 in your textbook, this is in chapter 26 of your textbook, but this is something that I wanted to cover at the beginning of the class so we can incorporate it into every organ system throughout the 2-semester sequence. When we look at aging, aging is a process that happens to all of us. We all get older, and it happens with the passage of time. And as we look at this, there are some degenerative changes that occur as we get older. These degenerative changes specifically associated with age is not looking older, but the loss of function or degeneration is called senescence. And when we think of senescence, I want you to think of degeneration, a loss of function, the tissues and organs not functioning at peak capabilities. Now, this happens over time. We plateau typically in our 20s, and then we typically will stay peaked for a while, and then usually at about the age of 65, things start to go downhill pretty quickly for us as human beings. We lose our reserve capabilities, so our ability to run farther, our ability to deal with heat, and have physical stress to our body diminishes, our ability to have tissue repair diminishes, and our ability to maintain homeostasis also is diminished. And with that decreased ability to maintain homeostasis, we have an increased susceptibility to disease. As we look at Americans here in the United States, 1 in 9 is over the age of 65 as of 3 years ago, and that number is, that percentage is ticking up just a little bit now as we have the baby boomer generation retiring. So what does this mean? This means that over 10% of our population in the United States is at an age where they're going to need a lot of health care. As we look at the United States, we have a lot of diseases of affluence. And what do I mean by that? I mean diseases like heart disease, cancer, stroke, cardiovascular diseases associated with living a long time. What causes senescence is unclear. We really don't know why we have senescence taking place. Our bodies have a remarkable ability to heal themselves. We have a remarkable ability to regenerate brand new cells. We also have the ability to make new human beings. When a male and a female reproduce with each other, they make a brand new human being with young tissues. Why can't we, as a single individual, as a single organism, regenerate brand new tissues within our own bodies? Nobody knows. It's almost like we're just pre-programmed to get old and die, for lack of a better explanation. Personal health and fitness, exercising and eating right, these are things that can help us take care of ourselves and reduce the effects and delay the onset of senescence, but it doesn't prevent senescence. When we have senescence of one organ system, a loss of function of that organ system is typically going to cause a loss of function of other organ systems, where you have a cascade failure. Once one thing stops working, lots of things start working. As we look at the organ systems in our body, they don't degenerate at the same rate. For instance, our skin degenerates relatively quickly, but our bones don't degenerate that quickly. Some organ systems show moderate changes, others have very pronounced differences as we age. For instance, the reproductive system is one that has dramatic senescence. For females, we lose fertility dramatically at typically about the age of 35, there's a dramatic loss of fertility in females. And in males, starting at typically about the age 45, there's a dramatic increase in erectile dysfunction. It becomes much larger to achieve erection and maintain erection long enough for orgasm to occur. As we look at senescence, one of the things we should focus on with this senescence is that if we have good nutrition, we can slow it down. What does exercise do for us? It helps us to maintain endurance, joint and strength mobility. As we have exercise, it places mild stress in our bodies. And that mild stress is going to increase bone density to help fight off osteoporosis. The increased caloric use and increase in basal metabolic rate will help reduce obesity. With less obesity, we're typically going to have less hypertension. And with less obesity, we're typically going to have less diabetes, or type 2 diabetes, diabetes mellitus. As we look at 90-year-olds, there's been some very interesting physical therapy studies conducted that find that if someone at the age of 90 exercises for 40 minutes per week, over the course of 6 months, they can have a threefold increase in their physical strength. It's never too late to start exercising. If 90-year-olds can increase their muscular strength, anybody can. Now, when we think of resistance exercises will dramatically reduce our risk of bone fractures and also increase muscular hypertrophy. When we think of endurance exercises, these are the ones that are going to reduce body fat and increase cardiac output. So when we look at these exercise regimens, we typically are going to, if we have 3 to 5 regimens that are 20 to 60 minutes a week, or 20 to 60 minutes long, 3 to 5 regimens per week that are an hour or less, we are going to be able to raise our heart rate and reduce our overall senescence on our bodies. So in short, if you weren't motivated to exercise, hopefully this information has motivated you now to start exercising. As senescence compounds in our bodies, we eventually are going to lose the ability completely to maintain homeostasis, and we die. As we look at life expectancy, we define life expectancy as the average length in a given population. Over the last century, it's increased substantially. Over the last couple years in the United States, we've had a decrease in life expectancy, typically related to deaths of despair. Suicide rates have been going up. Drug abuse deaths have been on the rise. But as we look at an average male or boy in the United States, they can expect to live for 76.2 years. Born right now in the United States, the average female or girl could expect to live for 81 years. And in terms of the lifespan, human lifespan has not been increasing for many centuries. The max lifespan, the max recorded lifespan in the modern era has been 122 years. Nobody has broken that record. So if we can hit 100, most people are pretty proud of themselves if they can make it to 100, but 122 years is currently the record. When we think of death, there's no actual instant of biological death that we can actually define. Some organs are going to keep functioning after our heart stops beating. Our brain can have a lack of cerebral activity, so the EEG, electroencephalogram, could be flat. But our reflexes, modulated by the spinal cord and brainstem, our heartbeat and respiration, can continue for 30 minutes to up to 24 hours. So when we typically think of death, we typically think of death as a failure of a particular organ, followed by a cascade of other organ failures. That's all we have for this recording. If you have any questions or comments, please feel free to post them on the class discussion board. And as always, happy studies.